Thank you so much. Thank you so much, team. Instead of just one challenging case, I just have few tips before we do the challenging case. Yeah. So always I have something which I always tell all my trainees is, if you have never made a mistake, you have never tried anything new. But before you try anything new, make sure that you know a lot about the old so that you make a mistake in the new, you always have something old to fall back on. So three mistakes I learned from is in refractive, you always have preoperative, intraoperative, and postoperative. Something small as the pupil diameter. Normal optic zone is 6.3, but this patient has 6.47. So preoperatively you assess and then increase it, it's much more better. Always go into additional evaluation like job profile and the need for LASIK and the psychological profile, which is very important. Make sure everything is transparent. Don't always you should make sure that the patient should not get 100% guarantee that they're going to get back a complete vision, because you always have anxious patients. I always tell them there is no 100% guarantee, but I will do my best. So that's the machine. So this is a case which I wanted to share, a simple mixed astigmatism, and all the parameters are perfect for both the eyes. Before were the days when I used to enter my LASIK theater like this. Scrub, everything ready, go straight, directly go, sit, and operate. So then I started to realize that patient which I had operated had a residual power of 1 spherical after a month. Oh my God. So what next? And why is that? I have two air conditions. One is the slit, and the one is the window one. So look at the humidity, which was 72%. So now what do I do nowadays is never scrub and go in. Look for the temperature. Look for the AC. Check the humidity. See which AC is on and which AC is off. Always make sure that you get everything right before you start itself, and let it end up with a lot of change. So always be the change. Check for the fluence, temperature, humidity, foot size, and everything, and get it ready. So just a small intraoperative surgery which I wanted to show. Once sometimes we take the flap, you know that I see that while I'm going to lift the flap, it is only half. If it is crossing the pupil axis, never continue with the surgery. Always put the flap back, deposit it, put a BCL, and then explain to the patient that you're going to do it as the next step. In a case of femto, the advantage is that even if the patient moves when there is a suction loss, you can see that the loss is there. You can always dock back, do the parameters perfectly, and you can see that it actually goes along the same plane. That's one of the advantage of the femto LASIK over the blade LASIK, because once you do a blade, you can never do a recut. It's always better to wait for around a month or two and do a surface ablative treatment. Post-operatively, what you see is sometimes you have an epithelial ingrowth. So always make sure that you lift the flap near the growth. I'll always lift whole, but before I make sure that the epithelium goes more inside, I just make sure that I rip off that epithelium in that area alone first, which comes out neatly. And then you should know that along the edge, there's going to be a lot of epithelial ingrowth, use of Excel sponge. And then you can lift the flap, and the rest of the areas, you give a complete wash, and then you place the bandage contact lens. So post-operatively, always meet the attender and patient, grade their pain, slit lamp evaluation, instructions, apply the first drop yourself where they get confident on you. And always I check for vision with both eyes. So always cross-check everything, make a checklist where you have something which is done. Do not skip any step in refractive surgery. I'm sure that none of the surgeries you should skip, but this is something where you can't afford to skip even a single step. And there's always someone to blame for the mistakes that happens in the theater. That is yourself. So make mistakes, but learn from them. Thank you.
Excellent presentation, Nishant. Can I request Dr. Somil sir to please comment on this and give our young refractive surgeons some tips on how to handle these traumatized flaps?
Thank you so much. And hi, Nishant, how are you?
Good, Samir sir.
Yeah, great. So, uh, points well taken, points well showcased, right? Right from preoperative, intraoperative to postoperative management. These are points which are oftenly not highlighted. And I would say that it's good that you brought about the points about air conditioning, fluence, how to check it out. yourself. And till date, personally, I always enter all the data in the machine myself. I don't rely upon my assistants to do that. In case if you're doing that, please recheck the data. As you said correctly, there's only one person to blame, that is yourself. So see that you are doing everything. Otherwise, the points are quite well taken, and they're perfect.
Thank you, sir. I just wanted to highlight those points that we tend to miss. I mean,
True.
managing a complication is good. I mean, preventively itself, you can prevent. I mean, with the machines which are there now and the expert hands of all the surgeons, very rarely you get a lot of complication nowadays compared to what it was 10, 15 years ago. Because pre-operatively, we tell them a strict no if it's going to be very flat or very steep and all that nowadays.
So
We
we've
don't
all
take.
grown wary of preoperative assessments.
Yes.
Exactly. And I feel as refractive surgeons, when you are learning, there are very, very few challenging cases that we see. When you're operating under your mentor, somehow all the cases are going absolutely perfectly. And then the marking and all that you're supposed to do, every day you're doing it. But the day a traumatic flap occurs, you realize that your marking has gone somewhere else, because it's so, so rare in refractive surgery. But even more important, because these are the patients who had 6x6 vision, and they are not going to compromise even on one line of vision here.
Exactly.
So,
Exactly.
Dr. Amrish,
Just
sir,
a-
are you there?
Yes, Dr. Vaishali.
May I just, yeah,
Yes,
just
ma'am.
30-second informal talk. Now that Nishant and Sneha, you both are there. So again, congratulations. And I was looking forward to Nishant's video because as Sneha knows very well that his videos and presentations are just awesome. So sorry for the informal talk, but I couldn't resist myself. Hello
Thank
and
you.
congratulations again.
Thank you. Thank you.
Absolutely, ma'am. Nishant's videos are always out of the box. So, Amrish, sir, are you there?